A VA decision once said there wasn't a link to service, even though the chart clearly showed a training accident and a torn rotator cuff. Hi, I'm Cameron Burrell, and today I'll show you how to get a medical Nexus opinion that actually ties those dots together.
Welcome to the Veteran Benefits Reset Podcast. This episode is for veterans and family members who want a practical, usable way to ask a clinician for a Nexus opinion, the single note that can change how a rater understands your claim.
First, a quick plain English definition. A medical nexus is a clinician's explanation linking your current diagnosis or ongoing symptom to a specific event, injury, or exposure during military service. A diagnosis says what's wrong. A nexus explains why it's related to service.
Why does that matter? Because VA raters need some medical link before awarding service connection. Without an explanation that connects the dots, dates, findings, and a rationale, a rater may say there's not enough evidence. Not every useful opinion is a long medical legal report. Short and specific often wins. What a rater needs are three things: events or dates, objective findings, and a brief medical explanation that ties those findings back to service. That's it.
Who can write a nexus? VA clinicians, private treating providers, and independent examiners all can be considered. Each has pros and cons. VA notes are already in VA records, private docs bring continuity, and independent exams can give focused, specialist language when needed.
A practical reality. Some clinicians worry about legal wording and may decline to write a formal opinion. That's normal. Your job is to make it easy for them, provide records, offer a short template, and keep the ask medical, not legal. On the air, I'm going to read a Titan version you can say aloud or paste into a message. The full copy is in the show notes if you want to copy-paste a longer version.
Hi, Dr. Name. I'm preparing a VA claim and would appreciate a brief medical opinion linking my condition to this in-service event. Please note the event dates, any imaging or exam findings, and a short medical explanation tying those findings to the event. Please sign and include your credentials. Thank you.
That version is short, direct, and keeps the clinician inside their medical lane. Say that, then attach the records, which brings us to the 3-item checklist you should include with your request.
Checklist item 1. Attach a brief written description or your service statement that shows the in-service event and dates. Item 2. Attach the most recent medical records and key test results. For example, MRI right shoulder 2022-03-15.pdf or the clinic notes that document ongoing treatment. Item 3. Ask for a short written opinion that ties those records to the event and includes the clinician's signature and credentials.
What makes a strong nexus? Look for 4 elements. 1. A temporal link, clear dates or a timeline. 2. Objective findings, imaging, labs, exam notes. 3. A connected medical explanation. And 4. The clinician's signature and credentials. If they reference specific reports, that helps the rater verify the opinion quickly.
Watch out for weak language. A line that just says related to service without dates or rationale is unlikely to move the needle. A much stronger sentence is, based on the documented 2010 training injury and current MRI showing a rotator cuff tear consistent with the injury mechanism, it is my medical opinion that the rotator cuff pathology is related to the 2010 service event. That single sentence connects the dots for the rater.
If your treating provider declines, you have options. Request a DBQ-style note, seek a second opinion from a specialist, or work with a VSO to request a VA exam. An independent medical exam can also supply focused language if a treating clinician won't. Keep a record of your request and the response, when you asked, what you sent, and whether they agreed or declined.
One small but important tip: name the attachments clearly. Clinicians see a lot of documents. A file named Service Statement 2010 or MRI right shoulder 2022-0315 makes it easy for them to find the report you mean, and that quick clarity increases the chance they'll respond. Next step for you right now: send that short message today. Attach your service statement and the 2 most relevant clinic or imaging notes, and set a calendar reminder to follow up in 2 weeks. Clinics are busy. A polite nudge helps. If they agree, get the opinion in writing. Scan it into your claims folder and upload it to your VAE folder if you use one.
Quick recap, 3 sentences. A Nexus links diagnosis to service. Ask politely and provide records. And make sure the final note includes dates, objective findings, and a short medical rationale. Your immediate action, send the short on-air message, attach your records, and follow up in 2 weeks.
Thanks for listening to the Veteran Benefits Reset podcast. If this episode helped, follow the podcast, leave a review, and share it with another veteran who could benefit. The full email template and a printable checklist are in the show notes at vetbizmedia.com/veteranssev. And remember, your service did not expire. Your story is still worth reviewing. Take the next responsible step. Thank you.